Be here with you all today. And I know you have very busy days, so we are not going to take your full hour. We're going to get you back to your real work here. But we did want to thank you for taking the time. We know you, most of you are in settings where you're caring for patients, and it's a very hard time for you all, especially in the North State. So we welcome you. This project is sponsored by Anthem and California Health and Wellness. And we'll have some words from our sponsors in just a minute here. But just to note, what we'll cover today is a quick introduction of participants, those who we hope will join us in forming our eConsult Coalition, since this is our very first meeting today. Most of you are familiar with eConsult, so we'll just give a little bit of a background on what we've seen happen with eConsult in terms of growth across the state and country. Talk a little bit about what we'd like to see happen as part of our coalition and activities that we support. We have Marianne Souza from ConfirmEd on today to talk us through what the eConsult workflow looks like, in case those of you who are new to eConsult haven't seen this yet. And we're happy to have our plans on to talk a bit about what is offered to you as providers and patients, and what hopefully can be supportive in response to the wildfire emergency, since we all know this is hitting our state harder than ever. Just one last little request, if you don't mind keeping yourself on mute, we'll be discussing our content later in the call, so thanks so much. My colleague Robbie Franceschini is on. He and I are at Blue Path Health. I think I mentioned we're a consulting group in Northern California. We do many different telehealth projects across the state. And we'll talk a little bit about what this is going to look like moving forward. So we want to meet on a monthly basis. We're excited to see so many providers, and along with our IPAs and our plans on our call today, we want to talk with you on a monthly basis, in addition to providing one-on-one outreach or any technical assistance that we can offer to you. So with that, we'll do a quick round of introductions. And I know this is not something we'll do on every call, but since this is the first time we are meeting together, we'd just like to give a quick opportunity for you to announce yourself and your organization. So I'll just do a little example. My name is Libby Segarra, and I work with Blue Path Health, and I'm facilitating this eConsult work group. And then I'm going to call on the Anthem folks. So Sonia, would you mind introducing yourself? Oh, Sonia, you're on mute too.
Thanks. Sonia Hamill, I am a provider experience manager here at Anthem Blue Cross.
Thanks, Sonia. I think we have Armando Milan also. Armando, would you like to introduce yourself? Take yourself on mute, off mute.
Yeah, thank you. So this is Armando. I'm the director of California Medicaid Strategy here at Anthem Blue Cross.
Thanks, Armando. Karina?
Hi, everyone. My name is Karina Mendoza. I'm account coordinator with Anthem Blue Cross.
Great, thanks, Karina. I'm just going down my list here, and are there any other Anthem team members on today? Melissa, I think you're on. Melissa, we'll come back to you. Any other Anthem introductions? Okay, I think we have Mark Schweier. Go ahead.
No, good morning. My name is Jose, and I'm the account consultant for the North.
Thank you so much, Jose. We also have a California Health and Wellness team on. So Mark, would you like to introduce yourself?
Hi, everybody. It's Mark Schwer. I'm the Director of Telehealth Programs for HealthNet and California Health and Wellness, the Centene groups in California. So glad to have everybody here and glad to be part of the effort. Thank you.
Thanks so much, Mark. I'm not sure if any other team members from California Health and Wellness are on. Do you know by any chance? Okay, I think we'll move on.
Sorry, no. There's nobody else on, just me.
No,
sorry,
no
Libby.
worries. Thank you. Do we have EMPLA on today? Dr. Kaur?
This is Karen. I am the Director of Quality for Ampla Health.
Thanks so much for joining us.
Thank you.
And I believe we have Barton on also.
This is Amalia from Ampla Health and Cynthia Ermer from Ampla Health. I'm the site administrator and Cynthia's a nursing supervisor.
Oh, thank you so much. I forgot to ask if others were on. Thanks for joining us today. Okay, we have Barton on too, I believe.
Hi, this is Mary Quinzer. I'm the Physician Billing and Customer Service Manager at Barton.
Thank you so much, Mary.
And Melissa Ryan, Revenue Integrity Manager for Barton.
Wonderful. And we have Marianne Souza with ConfirmEd. Marianne, go ahead.
Hi, this is Marianne Souza. I'm the Senior National Sales Representative at ConfirmEd.
Thanks, Marianne. Do we have anyone from CRIB on today? So we have engagement with California Rural Indian Health Board, and we hope to see them on our future calls. So thank you. Chapaday.
Hi, this is Darla Clark. I'm Chief Operations at Chapaday Indian Health.
Thank you, Darla. I think I saw another Chapaday person.
Hi, my name is Debbie Arve. I'm the Medical Practice Manager at Chapaday Indian Health.
Thank you, Debbie. Anyone else I missed? Okay, I think we have Doug from Eastern Plumas. Doug, are you on?
Yeah, Doug McCoy, CEO at Eastern Plumas Healthcare, and we also have Paul Bruning, who is our Director of Clinics at EPHC.
Thank you. Okay, El Dorado CHC, are you on? Okay, I think I saw some Feather River folks on. Okay, we'll come back. They might be on mute. I think we have Nick from Harmony. Nick, are you there?
Hi, yeah, this is Nick Sigala, Chief Operations for Harmony Health. I also have Alicia Aguirre, our Operations Manager here with me.
Thanks so much for taking the time to join us. Okay, Navano team, I think we have a few of you on.
I'll go first. Nicolette DiNardo, Director of Provider Relations and Quality Improvement.
Thanks, Nicolette. Anyone else from Navano on today?
Hi, this is Olivia Martinez. I am the Provider Relations Supervisor.
Thanks so much.
And hi, everyone.
Oh, go ahead.
Oh, go ahead, Lynette. So my name is Katie, and I'm the Quality Manager here at Navano Physicians.
Thank you.
And this is Lynette Rome, the Chief Compliance Officer at Navano Physicians.
Thanks, Lynette. Okay, Northern Valley, are you on? Okay, we'll come back. I thought I saw someone pop in. Oroville, anyone from Oroville Hospital on today? All right, Peachtree. Okay, Plumas.
This is Lacey McKenzie. I'm the Revenue Cycle Manager at Plumas.
Thanks so much, Lacey. Appreciate it. All right, Sierra Family, I think I saw you just pop in.
Amanda Batchkoff, Lead Referral Coordinator, also followed by Tara Tenney, my other record coordinator.
Thank you, Amanda and Tara. Appreciate your time. Okay, is WellSpace on today?
Yeah, this is Cordia Losh, the Chief Strategy Officer at WellSpace Health.
Thank you so much for joining. And I know we have Western CR Francine.
Hi, this is Francine Novak, Senior Director of Operations. Glad to be here. Thank you.
Thanks so much. So I know we have over 30 people on our call today. If there's anyone I missed, please feel free to use the chat. You might be in a space where you can't speak. So if we don't get a chance to introduce you, please use the chat, or if you want to email, make sure that we know you're joining us. Our coalition is open to anyone who's seeing Medi-Cal patients. We welcome clinics, practices, any providers who want to be able to improve access to specialty care. So I'm going to start just giving just a moment for our plans to say a few words on why this coalition is important and how it got started. So Armando, do you want to get us kicked off?
Yes, thanks, Libby. So we're excited to kick off the North Rural eConsult Coalition, and would like to thank the attendees for joining us. We started this work in the Central Valley in January, and we're seeing a lot of benefits for both the members and providers. The adoption of eConsults in the Central has really helped transform medical and specialty care by enhancing the provider-to-provider communication and improving quality and equity of care for patients. Anthem works with other health plans and payers to come together on this effort just to help and support payment for eConsult and fee-for-service in capitated markets, and also to help implement the adoption of eConsults to make it a little bit more seamless for providers. So Anthem is eager for today's kickoff to expand this up to the North Rural counties, and we'd like to thank everyone for joining the call.
Thanks, Armando, and we appreciate your support of this. And I think, Mark Schreier, I think it would be great to hear a California Health and Wellness perspective, since you've been doing this for a while.
Yeah, Libby, thanks. So Armando, you did a great job there and just teeing it up. We see the value for our members in making sure that their care is seamless and they get every opportunity to stay in their primary care space where their physicians can remain central in their care. We also realize that a lot of our northern territories are very remote, and it's, especially during the winter months, it's very difficult, particularly during these challenging times with the wildfires and COVID. Being able to be managed in your local communities is more important now than ever, and then not having to be able to have to travel to long distances to providers in cities far away is important to us. So it's not very often you see the health plans work together. We tend to be fierce competitors, but this is it's a really good relationship and effort for us to partner with our partner plans in these counties, so that the work is seamless in one unique experience for the providers. So thanks, Libby, for your team's efforts here, and thanks for all the attendees. I really appreciate you guys joining the table and the effort. Thanks.
Thank you so much, Mark. And we're so glad to have your provider experience teams on to help us to communicate what eConsult does, how it works. And it's been great to work with you all. I've had a chance to talk to a number of your clinics over the past couple of weeks, and those who we haven't been able to connect, we understand why. We understand how busy you are right now, and we hope to talk to you in the coming weeks. I also want to note the Blue Path Health team is on, and we'll be working with you over the next few months. So my colleagues Kira Keegan, Lauren Jacobson, and Robbie Franceschini are on also. So thanks for joining us. We wanted to just cover with you some key takeaways. We've been working to support what we call the eConsult work group, which convenes payers and providers and policy leaders from across the country. We meet on a monthly basis to just gather what's published on eConsult, look at programs that are successfully conducting eConsults and really seeing an impact on patient care. So many of you are familiar with these data and these benefits. We're not going to spend too much time, but just want to share with you that there are a number of publications out there to show that this is a way to improve getting response times from specialists, specialty access for your patients. We know that this improves the ability to schedule patients for face-to-face visits. Just in case you're very new to eConsult, this is asynchronous care between a primary care provider and a specialist. So it's not a face-to-face or a telehealth visit. However, it facilitates that when it does eventually happen, and that the provider, the specialist, is armed with the information that they need to better treat that patient. When we look at what's happening in the North State, I've lived in Northern California my whole life. So right now we have fires, then we have snow, we have things that limit our ability to get patients to travel to care. So with eConsult, we see the ability for patients to avoid a visit if it doesn't have to happen. So reducing travel, reducing time off work, reducing inappropriate referrals. And then for you as clinics, reducing no-shows. So you end up getting those patients scheduled, those patients that need to be seen face-to-face, or those that absolutely need that visit. We talk a lot on our coalition calls, and we will talk a lot about how to make this easier for primary care providers. And that's what ConfirmEd's going to address today. We see through these programs a very high satisfaction rate for primary care providers, obviously specialist satisfaction too. And looking at patients and members, through eConsult, we hope to make your patients happier and get them the care that they need more quickly. If there are questions about data, what we have out there on eConsult, it's available on our website, econsultworkgroup.com, but we can also get these data to you if they're of interest. Happy to share these publications. And eConsult's been a bit of a journey, and just so you know what's happened across California in the past 5 years or more, it was pretty much unrecognized. Even though maybe some of you were doing eConsults 5 or more years ago, it was something that the state may not have understood, and policymakers' plans may not have gotten started with yet. You as clinics, FQHCs were really leading the way in making this happen. So public hospitals and FQHCs have done these programs for a while now. We started the eConsult work group about 6 years ago, and now we've grown to 150 organizations. Probably our biggest voices are FQHCs and managed care plans, with public hospitals being part of that too. So back in 2017, 2018, we made some traction with Department of Healthcare Services, Medi-Cal, in that a code for eConsult, a CPT code for specialists performing eConsults, was added to the Medi-Cal fee list. So we see now that specialists can bill this. So that was an advancement that we saw in the past few years. We work, some of you may be active in other forms of telehealth too, or other telehealth media. So we work closely with the California Telehealth Policy Coalition to make sure that we keep you up to speed on what's happening policy-wise. And Robbie, I'll talk about that in a little bit here. So we also work with Department of Managed Healthcare in line with DHCS to make sure that the state is aware of all the work that you're doing, clinics and plans to make this work. And so through all this work, it became apparent that there was the need for plans to collaborate, as Armando and Mark mentioned, that plans working together can make this easier for you as primary care providers, so you can do this for all of your Medi-Cal patients. So we formed this North Rural eConsult Coalition, and I welcome Mark and Armando to pipe in here. So we really have some pretty simple goals: engaging you as primary care providers and specialist organizations, any of your other stakeholders or referral partners. This is open and free to all who want to join. We meet on a monthly basis, as I mentioned, and we want to provide education in CME. We've had a few CME courses for other organizations across the state that have been very well received, with over 80 people on each of these calls. So it's great to see that CME is of interest. We're working to gain more policy and reimbursement support traction at the state level. Talk about that in a minute. And we really, we're getting some attention. This has been going on in the Central Valley for a while now. And these programs are really being followed by others across the country in terms of how FQs and plans are working together to make this work. I say FQs, but I should say community health centers, RHCs, Indian health centers also. We, as working together, are gathering the data, the utilization that we show in the FQHCs to show region-wide dashboards of what's happening, and really sharing those with others to see that traction is happening, that this is really taking off. And we hope to make this model something that others can do across the state. I'll stop there. I know that Karina, you might want to pipe in here, or Mark, you might want to share some of the work that we've done across the state. Karina, do you want to start?
Yeah, this is Karina. Hi, thank you, Libby. Yeah, I've been working really closely with Libby and Mark on our Central Valley eConsult Coalition. And I just really like to say that I'm really excited to see this North Coalition kick off. Yes, around policy and reimbursement, Anthem really understands that to make this adaptable for the health centers to utilize eConsults and fit it into their workflow, that we really have to help make it seamless. So working with, California Health and Wellness and HealthNet to make sure that this is accessible and available to all of our Medi-Cal patients. It's, really one of the things that we've been really happy to support. Anthem is looking at also possibly, doing an uninsured coverage grant coming soon. Nothing set in stone yet, but we are hoping to also provide additional support for uninsured patients at the FQHCs, so they have access to eConsults as well. We just really see a lot of value that the eConsults can bring, as far as, closing some of those referrals with an eConsult, enhancing that provider to provider communication. So yeah, that's.
Thanks, Karina. Mark, did you have anything to add on what you're seeing across the state? I know there's been a lot of HealthNet work done to advance eConsult.
Yeah, thanks, Libby. So, again, we're covering the cost for the next year for capitated organizations to help promote this across the state. And we're paying in perpetuity, for fee-for-service members to get the consults. And I think one of the important facets of this effort is really, I hate to sound cliche-ish, but it really takes a village to get these programs up and running and off the ground. And it takes a very concerted effort driven at the member experience and making sure that clinical outcomes are optimal, and PCPs are always in the loop. So that requires change, and change is hard, especially when there's multiple competing demands like the COVID crisis and the wildfires going on. But at the end of the day, it's this effort's help really look at barriers and resolution and solutions, and also best practices. So it's something that it's very important to our health plan, and we really, like I said, we appreciate the collaboration and everybody joining, and look forward to seeing this progress in the northern counties.
Thanks so much, Mark and Karina. So I think we've covered what this is going to look like working and forming a coalition, but just to get a little more specific on what we're calling our coalition is, as I mentioned, it's open to anyone. We want to provide support for you as primary care providers, engaging both those who've been doing e-consult for a while and new practices, showing and sharing our measures of success, which may be provider utilization and satisfaction, providing any communication tools that you need. We have monthly newsletters. We have a website that we will share with you all to be able to be a source of information for you all. We want to hear from you as to which specialties are most important, which are most challenging, be able to engage your specialty referral partners. And as I mentioned before, just share the utilization and progress that we make. We, as you know, those who are doing e-consult know that e-consult has a specific use. It's not for acute or emergent care. It's for, it can be considered as a first step to a specialty referral for all non-urgent and routine non-procedural referral requests. And I think what's great about what many of you are doing and what ConfirmEd supports is that this mirrors your referral process at the clinic. So the patient presents, the PCP sends that referral request, the PCP and the referral team decide whether it's appropriate. That's within the PCP's decision making power. And the specialty panel that's remote responds to this within 2 days. And with the PCPs being able to see that specialist advice, they can determine whether that patient needs to be seen in person following the clinic's referral workflow. So with that, I'm going to hand to Marianne Souza, who can talk a little bit more detail. Many of you are familiar with ConfirmEd, so this will be a fairly brief overview. But for those who haven't seen it, Marianne, go ahead and do a quick overview for us.
Thank you, Libby. Hi, everyone. Again, I'm Marianne Souza. I'm the Senior National Sales Representative at ConfirmEd. I'm located in California, in Fresno, and I've been working in healthcare here for over 20 years. I recently joined ConfirmEd in May of this year, and I'm really excited to be here and welcome you to the eConsult Coalition. So I'm just going to cover a couple of slides regarding the alignment of eConsults in referral workflows. So this first slide explains what an eConsult is. An eConsult is a complete consult sent electronically to a specialist, including appropriate PHI from the patient's chart, with a formal consult note in response. So the PCP orders an e-consult from ConfirmEd and sends the request with the appropriate PHI from the patient's medical record. There's no extra steps for the clinicians, and ConfirmEd manages the entire e-consult workflow process. It's seamless integration into your existing workflow. So however you are currently sending referrals to your traditional on-ground providers, that is how you will be sending a referral to ConfirmEd. There's no additional technology needed, and it's completely HIPAA compliant. The information is then sent to one of our specialists who reviews the consult and responds with a diagnosis, treatment, and management information within 2 business days. And that timely response from the specialist will be part of the patient's medical record. Next slide. It's taking a little bit of time to load. There it is. So this slide compares the typical specialty care patient journey without e-consults versus with e-consults. So without e-consults, the average length of time for a patient to have a specialty consult can be 6 months or longer. The patient visits their PCP, and a face-to-face specialty referral is requested by the PCP. The patient can wait 6 months or longer for the appointment. The patient might have to drive several hours to see the specialist and often have to wait long periods of time for their visit. And then the PCP often has to wait several weeks or months to receive the notes from the specialist. And then at that time, the PCP discusses the treatment plan with the patient. With ConfirmEd e-consults, the average length of time to get a specialty consult is 2 business days. Again, the patient goes to see their PCP. A ConfirmEd e-consult is requested by the PCP using your traditional referral processes. Our ConfirmEd team reviews and forwards it to the appropriate specialist. And then the specialist reviews the PCP's questions, notes, records, labs, et cetera, and provides expert advice. The team forwards the e-consult notes back to the PCP, which become part of the patient's medical record. And then the PCP does receive that information within 2 business days and can then discuss the treatment plan with the patient. Next slide. Since this is customizable to your current referral workflows, we have various communication methods depending on what your current referral system is. And this slide provides an example of a PCP referral order for a cardiology e-consult. So as you can see, this is a referral in an EHR. There's clinical information and comments entered by the PCP with a question as to whether or not this patient needs to see a cardiologist face-to-face, or if this could be managed by the PCP. The PCP has attached clinical documentation, the most recent progress notes, EKG, lab work for the last 6 months, and a hospital record, and the referral is being sent to ConfirmMed. Next slide. And this is just one other example of an outgoing referral. This slide provides an example of a referral order for an endocrinology e-consult. So as you can see, this patient is being referred out for diabetes, and they are attaching the relevant medical record information along with the e-consult. And I think that's all for today. So if any of you are interested in learning more about e-consults, we would be happy to schedule some time to meet with your team. Thanks, Libby.
Thanks so much, Marianne. And with that, since I think we have experts in e-consult on the phone, and then we have those who may be brand new to e-consult, feel free to use the chat and send any questions for Marianne, or else you can send them to me and we can get back to you on these. And if you need to get up and running with ConfirmMed, we're happy to help that with that process. With that, we'd like to talk a little bit about resources that are available. I think e-consult is probably not top of mind with folks who are dealing with immediate danger and emergencies such as fires. So we want to talk about the fact that we're thinking about that. And I think we'll start with Anthem. Karina, would you like to speak to this slide?
Yes, hi everyone. So Anthem does recognize, everything that's going on up there with the wildfires. So there is Live Health Online. It's open to all residents. Live Health Online is a virtual telehealth platform. It's an app, can be downloaded from the App Store, Apple or Android, and patients can just access for a medical visit if anything comes up. I also put in some other resources here. A provider bulletin did just go out to all of our providers in our North Rural counties affected by the wildfires that goes over this, but this is also attached here on this presentation. So just going over the relaxed benefits for refills and authorizations. We've also deployed some of our emergency response iPad kiosks out to county locations. So there's just the locations here. Plumas District Hospital has an iPad kiosk where patients can go to access the Live Health Online. The Live Health Online application is installed on the kiosk itself. So if they need to do that, they can access it there for medical services. So just wanted to call that out. If any of you guys are experiencing any closures, this is just another resource for your patients to access medical service outside of your clinic if needed, of course. So if there's any provider questions from provider organizations, you can go ahead and contact Melissa Gora. She's our rep up there. So her email address is listed right here. Also, if any county organizations have any questions, they can send an email to Alicia Pimentel as well. So
thanks, Karina.
Thank you.
And Mark, I think you want to speak to additional California health and wellness resources available for providers.
Yeah, thanks, Libby. So we're doing a lot of the same things that Anthem is doing in terms of supporting our members and our providers both. You know, we've also relaxed prescription refill requirements, and we've got a expedited authorization process for prior authorizations. Our members have, you know, additional assistance through our MHN, our behavioral health provider network. And then we have virtual care. Members can download the Babylon app, Babylon Health app, and receive both physical health and behavioral health. And then there's also a COVID feature with symptom checker for all medical concerns. It's not limited to COVID, but there's also a COVID support platform as members, you know, stay at home and avoid, you know, getting out. And if they have to either quarantine or they're isolating, they're supported through that platform. And then there's also these numbers here that are available for information for our providers during the disasters.
Thank you so much, Mark. And we know that the first thought in dealing with fire or COVID issues is likely not eConsult, but we want to make it clear that this resource is available to your providers if it's a means of offering access to specialty care for patients who cannot travel, specialty advice, I should say, between communicating between your primary care providers and remote specialists. We hope that can provide some sort of business continuity when we know that work as usual is disrupted with what's happening in our current environment. So please let us know how we can help and provide examples or tools for you all. We do want to welcome any of your referral partners to join us too. So although I know you're probably dealing with some immediate concerns right now, if there is a way to engage your referral partners, we're happy to do that. If you have specialists in your communities that we can encourage to join our sessions and jump into the discussion around eConsult, we're happy to do that. We spoke to a lot of these value propositions that we're seeing that help providers. And this is pretty obvious to those of you who are doing eConsult. We appreciate those who jumped on and in the chat have shared your experiences and your satisfaction with eConsult. I just want to comment, I had a call with one of the clinics a couple of weeks ago, and one of your doctors showed up in her full suit, you know, her full protective gear, you know, with her full coverage, because she was in a tent doing COVID testing and vax. And I appreciate the time that you're giving to our project and thinking about this and how this might help your patients. With this, we want to give a few updates in terms of what's happening at the state level. So Robbie Franceschini from Blue Path will speak to policy updates that are related to eConsult. Go ahead, Robbie.
Thanks, Libby, and hi, everyone. This is Robbie Franceschini. Just briefly, you know, I think two major things to just share out with folks on this call. The first is SB 365, Senate Bill 365 on eConsult reimbursement. This bill is authored by Senator Ana Caballero from the 12th District, which covers Salinas and parts of Western Fresno County. It would require Medi-Cal reimbursement for eConsult for primary care providers, kind of referred to as treating providers in the bill, including those who are billing through FQHCs and RHCs. That bill is still alive right now. It's going to be heard in the Assembly Appropriations Committee this Thursday. So we should have more information coming out of that committee as to whether it'll, you know, move through the Assembly and to the governor's desk once that hearing has taken place. So we'll make sure we can provide an update on that at the next meeting. And then additionally, AB 133, this is the Health Omnibus Trailer Bill. So really kind of a successor to the major budget bill that was passed in June. This is a bill that kind of specifies a lot of the policy around those different budget allocations. So this was signed in late July. It does have a call out to eConsult in there, specifically budget that would create a statewide eConsult service for primary care, pediatric, and family practice providers to be able to support behavioral health conditions for their patients. Right now, the Department of Healthcare Services is still kind of fleshing out this service kind of within a larger youth and behavioral health initiative that was spelled out in this bill. So we can make sure to also provide more information as this e-consult service is built out for pediatric behavioral health. Additionally, there are some other provisions in there, around Medi-Cal expansion for undocumented adults 50 years and older. It also maintains current Medi-Cal telehealth policy through the end of next year. And in the meantime, the department will be convening a stakeholder advisory group to help provide guidance on utilization management and also around billing within the Medi-Cal telehealth policy to come up with a plan for Medi-Cal post-COVID-19. Right now, the department's putting that stakeholder group together, and the members of it will be announced at the end of August. And one of the stakeholder participants will be the California Primary Care Association. They're specifically spelled out as one of the required stakeholders to be included on that advisory group. Lastly, there is an opportunity for stakeholders to advocate for e-consult reimbursement within that stakeholder process. And we can make sure to, report back out as we hear more about what the department is proposing, and specifically as it pertains to Medi-Cal providers and, any opportunities there might be for stakeholders to work through different groups that are represented on the advisory group around e-consult and telehealth more broadly. So with that, I'll hand it back to you, Libby.
Thanks so much, Robbie. We just want to thank you all for those of you who are out there being vocal around your support for eConsult. We have reached out in the past and been able to engage, luckily, some champions. Joel Ramirez from Camarena Health down in the Central Valley, Danielle Oren, a doctor at Redwood Community Health Coalition in the Sonoma area. It's just been great to hear provider voices as Robbie and I work to be able to share the good work that everyone's doing out there. So thank you for your support and being vocal around eConsult. So we'll stop for a moment. We've been talking pretty quickly and just want to offer an opportunity for you. If you have questions, you can use the chat. If you are bold and brave enough, you may take yourself off mute and go ahead and ask the question or share any thoughts. I'm going to let people do that and do their typing if they like. And one thing I wanted to share with you all is we are listening to your interests and priorities. We've been asking around in terms of which specialties are most challenging for you to be able to address in the North State or access in the North State. So we've heard interest in rheumatology, neurology, mental health, women's health. We are interested in providing continuing medical education, so CME units and courses in response to your needs. So we welcome that input. If you have topics of interest that we can provide free CME to your providers to be able to make eConsult easier for them, we're happy to do so. So with that, just a few more resources that we want to make sure that you're aware of. We send a monthly newsletter to you all. If you did not get our newsletter today, please do let me know and you can be added to our list. With this, we send publications, tools, communications around eConsults, things that are sort of hot off the press research-wise. We like to share those with you as they are relevant. We're right now thinking of mental health and COVID publications around eConsult. We will share what comes up on a monthly basis with you all so that you can share them with your decision makers within your organizations. And in addition, we have a website, econsultworkgroup.com. We will have a section specific to North Rural eConsult within this website, so we can have your recorded webinars and tools, project overviews accessible via this website. But if you do want to access other tools around and publications of what's happening across the country, you can visit econsultworkgroup.com. And I think with that, we can wrap it up a little bit early today, just noting that We're going to try to meet consistently. This is hopefully lunchtime works for those who are seeing patients or those who want to fit this in between their other meetings. We try to get as many people as possible on these calls, but no matter which hat they wear. Speaking of that, if this doesn't work for you, you're welcome to delegate this meeting to another one of your team members as relevant. We'll reach out to you if we haven't gotten a chance to meet yet. We welcome your thoughts on CME, and we will let you know as soon as our North Rural eConsult website is launched. Any comments as we wrap up or questions? All right, thank you all for your time today, and we're thinking of you. We'll speak to you next month.